I'm from Hungary. I am a veterinary, and I have a big animal and small animal practice. I live in Barcs, more than 260 kilometers from Budapest. I would like to tell you something about my life. I have been practicing as a vet for 34 years. When I saw the limitation of the Western medicine, I started to learn homeopathy, and after 20 years, when I saw that its potential is also limited, I was on a congress in Kyiv, doesn't matter where, so it was also in Hungary, and I met Adrienne Bogardi in 2017, February, and we talked over a whole night. And in that year, I was traveling to Beijing in December. And when I arrived home, I started to learn, I started to practice image medicine. And now, one of my patients is very interesting. I would like to introduce her and her recovery from cancer, on the way of recovery. The name of this dog is Moshni. She's an 11 years old dog, mixed dog. She was adopted when she was about 1 year old. And when at the age of 5, epileptiform attacks started, mostly once a week, but when the weather was changing more often, sometimes 3 or 4 times a week. The first symptoms were off balance, tremors, and muscle spasm. This is very interesting because in my mind, the epilepsy is not these 3 symptoms only. I stay as a veterinarian. So she had never had blackout and leathering of the mouth. And after the attacks, her body was warm and she vomited. My veterinarian colleagues diagnosed epilepsy when she was 5. She got Difedan once a day, but the attacks still came. So for 6 years, he got Difedan continuously. This year, they noticed that her behavior was changed. The owner noticed. The dog got tired and unkind. They visited her doctor, and they diagnosed liver cancer. They made an ultrasonic examination. They found foci in the liver and on the ductus choledochus, foamy structure of the liver. The diagnosis is cancer. They said that the dog has half a year left. Of course, Difedan is still on. This is her report from the doctor. This is not so interesting here, but here the tumor marker is CEA is very high, from 0 to 5 microgram per liter. It moved up to 14. The next slide is about his liver function. It's also not too good. And now they visited me. First, they are living in Budapest, so it's not easy to have visits or meetings. The first step, I was changing Difedan to Sedalin. It's also a veterinarian medicine. The side effect of this medication is helping the work of the liver. And I gave homeopathic treatment, phosphorus 200, also to help the liver regeneration. At this time, from this time, she takes every second day sedaline. My image therapy is the next. At the first visit, the owner asked me to set up the diagnosis and treat the dog. The physical diagnosis was abdomen is very big, hard and tight. Hand diagnosis is the liver is very hot. With third eye diagnosis, I saw plenty of little blisters on the surface of the liver. I pet the body, started to wake up the liver, and with bigger, smaller method using BN mantra. I took out the heat from the liver. While I was working with the liver, the dog didn't move, stayed on the table as a statue. But when I wanted to move my hand, place my hand on the other part of her body, she wanted to go away, and she didn't let her treat. So I couldn't do anything else. I let them go home, and they came next time. I wrote it here until today because next day I sent the presentation here, but later I met the dog again more times. So until 28th of July, I treated Mashni 3 times. At the second visit, with third eye diagnosis, I didn't see blisters anymore, but nutmeg design on the surface of the liver. She's feeling much better, eats well, runs and barks a lot. Her stomach is tight, but smaller than before. Her liver is still hot, but cooler than the previous time. Since I have been treating her, she only had 2 very mild attacks. On 19th of August, Mashni came for a visit again. She is very well, had once a little attack, which was a very short vomiting. Her behavior is like it was before her illness. During the treatment, I experienced that the liver is lukewarm, the size is smaller, and from now she takes a half tablet sedaline twice a week. With third eye, I saw plenty of smaller and bigger bright spots in the liver. I didn't see the blisters on the surface anymore, and nor the nutmeg design. This time I was using bigger, smaller method, Kong, Ming, and BN mantras. On 29th of August, she had an ultrasonic examination. I asked them to go to the doctor for a control. This says, the liver is fully recognizable. The liver is bright, retained structure. Bile ducts are recognizable. Result, the liver did not worsen. At this time, she gets a quarter from the sedaline if it is necessary. Here is her report. I saw her 2 days later, 31st of August. She's still standing like a statue while treating the liver, but now she let the kidney and the sleep to treat too. This time I pet, wake up, and use BN mantra. The treatment continues. We have a lot to do till Mashni's full recovery. I think these first steps are just because the animals are very sensitive and give very quick answers for, as I found it earlier, for homeopathy, and as I see, for energy too. I would like to show you Mashni. That's she. She let her photo. This is when she didn't want to move at the first time. She was just standing on the table and moving as a statue. And now thank you for your attention. And I would like to say thank you to my teachers, sorry, to Adrienne, and because this couldn't be happened without her. Thank you.